I rise today, first of all, with a sigh of relief that the decision has been made not to go forward with a vote on a very divisive health care bill, but more importantly today, to say this is really an opportunity for us to work together to get something done, something very, very positive as it relates to healthcare costs, healthcare coverage for the people that we all represent in our states, and the people across the country. And I'm hopeful, Mr. President, that we will see action soon. I'm hopeful that it will be this week where we can come together around very, very good work that's being done in the Health Committee, the Health Education, Labor Pensions Committee, with our two great leaders, Senator Alexander, Senator Murray. They have been doing a number of committee meetings and forums. Very pleased to have participated in those. We've had great bipartisan participation, focusing on how to stabilize the current insurance marketplace. We know that that's got to be step one if we're going to bring down rates, bring down costs, and create a path forward so more insurance companies are participating in the current system. And I have great confidence that we can come together and get that done. And it needs to get done immediately because decisions are being made about rates this week. And I'm hopeful that we could take action on that this week. We also have two other things, very, very important dates that are looming by the end of the week. One is for the Children's Health Insurance Program, which covers 9 million American children across the country. In Michigan, we call it My Child. And we have children today that can go to the doctor, parents who can take their children to the doctor because of the My Child program. And the federal funding for that ends September 30th, this weekend, if we don't take action. This is another place of good news because the chairman, distinguished chairman of the Finance Committee, Senator Hatch, the distinguished ranking member, Senator Wyden, as well as myself and others, have introduced a bipartisan bill that will extend that program for an additional 5 years. And that needs to get done this week. It's a bipartisan effort, and I'm hopeful that that can get done as well. We also have community health centers, our federally qualified community health centers in our country, whose funding runs out again this weekend. Funding health centers has strong bipartisan support. Senator Roy Blunt and I have joined together with a total of 70 members of the Senate, 70 out of 100 members joining on a letter to continue the health funding for health centers. That needs to get done right away. And in addition to that, there are certain what we call health extenders or policies that are bipartisan that can be done together as well. So we see a picture of important efforts, stabilize the insurance markets to bring down costs, create more opportunity for competition in the marketplaces, continuing children's health insurance, continuing funding for health centers that are so critical in communities in every one of our states where people are getting the care they need at their local health center. Bringing those things together can be done. Now, it's a lot of work to do that in a couple of days, but these are bipartisan efforts that can be done together to show that, in fact, we can come together and get things done. I know that people in Michigan want us to do that. They want us to work together to get things done. They want us to focus on lowering costs for health care and increasing coverage. And they are anxious to see that we can come together to do that. So, Mr. President, I'm hopeful. It's only Tuesday. I'm hopeful with the remaining days of the week, given the bipartisanship that is there, the agreements that have been made on legislation already, that we could go into high gear in the next few days and come together and have a positive story, a good news story to tell at the end of this week about what we are able to do working together to be able to fix problems in the healthcare system and to be able to continue very important programs that provide healthcare for children and for families in local communities around the country. Thank you, Mr. President. I would yield the floor and suggest the absence of a quorum.